Hello, my name is Dr. Michael Wald, and I think it's pretty amazing that we're finally here at the Awakenings Fair after COVID has put things out of commission for a while. Motivates me even more to deliver to you accurate information. That means everything that I say, everything, there's scientific evidence for. You can go to pubmed.gov, which is the National Library of Medicine, and you can look up anything that I'm saying and it'll pop right up. If you have any difficulty substantiating anything that I say, just let me know. You can either email me or what have you. I don't want people to take my word for things. I think it's important to foster actual thinking and evaluation and questioning. Feel free to question me. That's how I learn, okay? So as I mentioned, I'm Dr. Michael Wald. My branding is the Blood Detective because I'm really pretty good at nutritionally interpreting lab tests. Particularly when people have seen lots of other doctors and they say your labs are normal, and they're not so normal. Come on. Yeah. So I also want to mention that I have a podcast called Ask the Blood Detective, which is on any podcast platform, including iTunes, every Tuesday. And you can also, so you just have to search for Ask the Blood Detective. And you can also go to my website, which is drmichaelwald.com, and you'll find tons of free content. We're talking 29 years of content, practically. So when I have my web people work on my site, they say, you have more content than the hospitals. So I'm constantly updating that. So there's videos, there's text information, all sorts of useful stuff. So what we're going to talk about right now are persistent health problems. And as the title will reveal to you, that we're talking about problems that don't easily go away. Sometimes they don't easily go away by themselves, and at other times they don't go away easily even when you get what seems to be the appropriate health care. So some of the health problems I've listed here, and in a moment I'm going to ask you what you're here for, and just, kind of, I'll point you, as I mentioned, you just say, I want to hear about this, that, or the other thing. It's not on this list. So again, persistent health problems or lingering health problems. They may wax and wane in terms of severity, but they're kind of there. So I'll ask a patient, so what's with that reflux? How often are you experiencing it? And they'll say, oh, doctor, well, not that much, maybe once a week. Every week, once a week. Well, that's not okay, because that means you're getting degenerative inflammatory changes in your esophagus and possibly even in your stomach, and you're only feeling it once a week, but it's happening all the time. And that could result in cancerous changes and Barrett's esophagitis. So that would be an example of anything that you have, even if you don't think it's so significant, but it's persistent, could be a problem. Okay? Any input on that when we're starting? So far, so good? Okay. So with persistent health problems, here's just a few of them that I have. And again, just start thinking about what you want to hear. So one obviously would be cardiovascular disease and stroke. It's a big one. Cardiovascular disease is still the #1 killer of both men and women. Although infectious diseases are starting to edge out, and as it was predicted by some very smart people that I knew, even as way back as 25 years ago, they predicted that infectious diseases by this time would be the #1 killer of people. And even if COVID wasn't even part of that, it's still that much of a problem. But of course, COVID cannot be ignored. It's a major morbidity, mortality disease. And then there's Alzheimer's dementia. Something like 30% of the general population over 30 have some degree of either minimal brain dysfunction or actual dementia. And I will tell you right now, once a person has dementia, you can use all the nutrition in the world, it won't work. I would love to say it does, but it does not. What it will do is prevent dementia or increase your risk of offsetting its formation. And if you get it at the earliest signs, that's better. I remember that there was an article in the New York Times Science section several years back where they concluded in the study that omega-3 fatty acids and nutrition in general did not work for people with advanced dementia. I admit it doesn't for advanced dementia, but I responded to that New York Times article with the references from PubMed.com, the National Library of Medicine, saying that it's very true what you're saying, but prevention, it does work. Why aren't you talking about that? So it's just a fact. Again, if you disagree with me, let me know, I'll send you the article. If you Google it, it'll come up as well, and it'll say scholarly articles. Those are the ones that you want to pay attention to. Everything else is suspect. Now, that doesn't mean that medical studies are perfect. Because if you do a medical study on, let's say, nutrition and what makes you susceptible to, let's say, cancer or chronic inflammation, you're going to get some response based on some grouping of people. Maybe they're men and women, maybe there's 50 of them, maybe there's 1,000 of them, maybe there's 3,000 of them, but none of them are you. So a scientific study at best is only give you an average picture of what you might need, but average people don't exist. Physicians and doctors and practitioners, they forget that a lot. So they give you what they're supposed to give and you don't respond, so clearly there's something wrong with you. And it's usually a mental health problem, like depression or you're anxious, so sorry, you know. So these are just projections from individuals, which we call doctors, that we think should know everything about everything. So we ask them about everything. Patient yesterday, she was so distraught. She came into my office, she was crying. She says, you know, I have tried to talk with my primary and she does not agree with nutrition. She thinks this is snake oil and the whole thing. I said, first of all, snake oil is healthy. It is. Snake oil has higher levels of omega-3 fatty acid than fish. And if I could process snake oil into a capsule, I would. Okay? And yes, I'm looking into it. So there's that myth. So let's be correct with our terms, right? And she's crying and crying. I said, why are you so upset? She says, well, you know, she doesn't believe in nutrition and I'm trying to do this naturally and I know it works. I've tried some things, but I need help. And I said, well, your doctor has 23 hours of nutrition training on average every 7 years in medical school. So do you think it's fair for you to feel that your doctor should know nutrition? She said, well, I never thought about it that way. You know, I said, that's like asking your dentist to give you a gynecological exam. Don't do it. You know, you don't expect from a particular specialist what you might expect from someone else who actually knows what they're doing. Long and short of it is, after the conversation, she realized that she was imposing a certain standard or expectation on a practitioner about what they should know when they're not trained. So people who are untrained that are health professionals should say, I am not trained in that, I do not know, but here's someone who does know, and that's what you do. You don't go into a tizzy and get angry and upset. This is clearly the individual's ego problem and self-esteem issue, because practitioners are people. You know, I recognize too that I have bias at the table too. My bias is natural as possible first, mostly. If you get in a car accident, you're having you're bleeding out of your skull, I'm not going to give you, ginkgo. You need to go to an emergency room fast. So, but for the most part, for these non-acute problems, most of the time, if nutrition has a role, you use that first because of safety concerns relative to the standard of care in medicine. Or sometimes it's a combination of it, Okay. Other concerns which are persistent health problems besides cardiovascular disease, stroke, Alzheimer's disease, or cancers, which I mentioned, chronic inflammatory states, being overweight, not just obese, but just overweight, overfat. Even a thin fat person's a problem. It took COVID, in my mind, when they came up with the list of comorbid conditions and had obesity in there, right? As a chronic inflammatory state, which is so bad of an inflammatory state that it makes you susceptible to, if you get an infection that pushes your inflammation even a little higher, you can die. But for years, patients would say to me who were obese, they would say, well, other than my obesity, I'm healthy. Wrong, not good. So, but now I think people understand a little bit more of that. But you don't have to be obese. You just have to be over fat relatively to your lean body tissue, okay? Any questions on that? How's this going so far? Making sense, okay? Because please, just interrupt me at any time. And then other conditions would be various arthritic conditions and autoimmune diseases. So these are just a sampling of some chronic problems that I've seen over the last 29 years of my practice. Is there any one of these or another you want me to start with? And if not, I'll just take myself. Yeah.
Autoimmune and arthritis.
Okay, so let's start with autoimmune. That's my favorite one. And we'll get to yours next. Actually, what's yours?
Well, mine is, I don't think mine's on the list. It's fatigue.
Fatigue, okay, great, it's on my list.
Chronic.
Okay, autoimmune fatigue.
I was going to say
okay,
arthritis
great.
as well.
Okay, and arthritis. So here's the thing, if I forget to cover any one of these, just let me know. Let's start with autoimmune disease because it's an extension of the conversation we're having soon on aging. So autoimmune disease basically is how human beings age. We break down, our various tissues start to break down. Our immune system now recognizes them as foreign because they're not quite what they should be. So the immune systems, one leg of it, produces antibodies which release inflammatory chemicals to try to get rid of these foreign tissues, except they happen to be you. This vicious cycle continues, and in medicine and rheumatology, where they deal with autoimmune conditions often, they always say the same thing, and a vicious cycle of destruction happens. Yes, now what? Well, easy. Here's the general answer to that. And this is what I call the blood detective common sense, right? So what do you do with that? Well, if you're breaking down faster than you can heal, that means that the degenerative process is exceeding the regenerative process. If you can enhance the healing nutritionally so that the regenerative process exceeds the degenerative process, then you're going to get a leg up on autoimmune disease, right? Make sense? And this opinion is not original to me, and we know it's true. So for example, if you're over 30 and you have any autoimmune disease or fatigue or arthritic condition, whether it's autoimmune related or not, you probably have a hormonal connection to your lack of repair. Because as of age 30 or so, 30, 35, your adrenal hormone DHEA, which builds the body up, starts to decline precipitously. And then it's an anabolic steroid in the sense that it builds up lean mass, not just muscle mass, but organ mass. So as you age, you lose lean mass, which includes organ mass. And organs make the chemistries we measure on a blood test. So if you get older and you lose that lean mass, your labs become more abnormal. So if you improve your labs, wonderful, right? But if you improve your labs at the same time that you can measurably increase your lean mass, that's going to offset autoimmune disease, which of course can be a form of arthritis and or fatigue. So just to summarize that, we know that autoimmune is this process that can be triggered by any number of things. Sometimes you've done nothing wrong and your genes just flip a switch. They upregulate and encode for certain proteins, which produce certain inflammatory mediators, and that's that. Now that doesn't mean you can't use diet and other aspects of healthy lifestyle, improve sleep, exercise, avoid dehydration, reduce stress. Those things help to downregulate those genes which encode for inflammation. So those are called epigenetic factors. So you're born with certain genes, and sometimes you have some broken genes and you have specific diseases. But most of the time, that's not how most diseases happen. They're not genetic. There's really relatively few genetic diseases that way. But most diseases are epigenetic, meaning your genes are fine, but due to other factors that are not being met, like again, poor diet and hydration and all kinds of radiation exposure, all these different things, then those genes get weak, and when a combination of them get weak, then that leads to certain health problems. So there are whole textbooks written on epigenetic nutrition, which again is just a fancy term for using nutrition and lifestyle to downregulate bad genes and upregulate good genes. And as you can imagine, everything that you've ever heard about that's healthy, plant-based foods and those sorts of things, generally upregulate the positive genes, the good genes, but not always. Because if you have an allergy to broccoli, for example, that's going to produce inflammation in you. But broccoli is supposed to be a healthy food. Well, that's just a generalization. Always, always, always be suspicious of generalizations. My field of natural health care mostly works out of generalizations. Patients will say, Dr. Wald, I have fatigue, and I took the iron and nothing worked. And I'll say, okay, well, iron deficiency anemia is only one cause of fatigue. And just because you have iron deficiency anemia in your lab testing doesn't even mean that caused your fatigue. So maybe there's other types of anemias. And there are over 14 that I can name off the top of my head. I'll give you 5. So one's iron anemia, there's B6 anemia, there's glutathione anemia, there's vitamin C anemia, there is a protein anemia, there's B12 anemia, the list goes on and on. Anemia just means deficiency. So if you're going to deal with someone's fatigue or autoimmune disease or arthritic autoimmune disease, you need to know, number one, how well they absorb or malabsorb. I always do absorption tests on my patients first day, because if you take all the right stuff, but you're not absorbing properly, that's an issue, right? Everyone's clear on the malabsorption part? In traditional gastroenterology in the 50s, they used to do malabsorption tests, routinely. But now you never see a gastroenterologist recommending them. Not because it doesn't work. They're more interested in endoscopies and colonoscopies. Maybe because they make them a lot more money. But the closest they get to malabsorption work is by diagnosing someone with celiac disease and saying, don't eat gluten ever, which is the right thing to do, of course, and then they ignore any of the other nutritional issues that could be causing autoimmune disease, arthritis, or fatigue, which were caused from years of the malabsorption from celiac disease. So they just say, well, stop the gluten. They look back in the gastrointestinal tract, the small intestine, about 6 months. The villi, the absorption cells, are perfectly normal. Great from here on out. But what about the last 20 years of misdiagnosis? and the other nutritional issues I can have. I find boatloads of abnormalities in nutrition with individuals with all of these persistent conditions. So when we're talking about degenerative conditions and persistent health problems, there may be some common denominators. So one is that, again, people may malabsorb. And if you are over 50, 60% of you malabsorb, which means you do not absorb normally. So you check the rate of the malabsorption. Let's say you malabsorb 30%. You might have to up the doses of your nutrients or foods in accordance with that. But if you don't know to do that, then you don't. And so you'll have a relative deficiency. Yes?
How do you test for absorption and malabsorption?
A simple test would be an indican test in the urine. So urinary indican is an old malabsorption test, very well researched, stood the test of time. So that's one example.
Urine?
What's that?
You do it through the urine?
Yeah, that's a
Does
urine
it-
test,
yeah.
yes. And then sometimes you can know if there's malabsorption based on looking at the labs and seeing certain patterns. So for example, I had a patient recently who had a cholesterol less than 160, it was like 155, and she said, yeah, my doctor said that was great. I said, well, cholesterol lower than 160 increases cancer risk exponentially. And I read her the detail from my own book, but, which may be suspect, right? But that's in many other lab books as well. So if you don't have enough cholesterol, cholesterol acts like a sponge to absorb free radicals, which can damage DNA, causing cancer or autoimmune disease, or hyperutilized nutrition ending up in fatigue. So, so when you look at a lab test and you see that someone has, like, say, low normal cholesterol and maybe they have a slight borderline iron anemia, but it's still normal, or their total protein is just in the normal range, this plus symptoms tells you, yeah, this is probably a malabsorber. You see, so it's patterns like that. So one person said to me, yeah, my homocysteine level's finally normal. It's a toxic amino acid, by the way. And when I looked at her diet, I realized that she was hardly eating any protein. Well, homocysteine is a protein. If you're gonna check the test, you have to make sure the person's protein is normal so they have the capacity to reduce homocysteine. But because she reduced her protein, it artificially made the test normal, but it wasn't, you see. So again, these are the same things I teach to professionals. I'm not holding back any details with you. Any input on that, questions on that? So far, so good. So as far as fatigue, fatigue can be caused, as I mentioned, by any one of those anemias. You can have a nervous system that's degenerating, which is the seat of your perception of energy and energy and fatigue or malaise. So it could be a neurologic condition. Inflammation is always at the fundamental, it's either at the bottom end, meaning the most important baseline of which many conditions can happen. And for example, you might be fatigued because you have low blood sugar. You might be fatigued because you're exposed to toxic heavy metals, which literally interfere with all the energy producing pathways in the body. It's like throwing a wrench in a fan and just kills it, right? And then if you get a spark going, it can go back in the wall and blow everything up. So my point is that these are some forms of fatigue. Others might be that the blood sugar is actually too high, or that the person may have hyperthyroidism as opposed to hypothyroidism, or the person with not enough energy might have weak adrenal glands. They might have either outright disease of the adrenals, called Addison's disease, which is the deficiency of the adrenals. That's all the endocrinologists know about. They don't like to talk about it. They will be very upset with you if you even mention the word adrenal fatigue. What do you mean by that? We don't do that. It's either you're healthy in your adrenals or you're not. Any psychiatrist will tell you that's a person who needs therapy. Because with all joking aside, that's black and white thinking. That's what children do. It's either this or that. And it's what most adults actually do. And they don't realize they're doing it. You know, I did this, I did that. Now what is there? Have it everything in between. Have it everything in between. Try that one on for size, which opens up a lot of possibility. Infections, chronic infections, acute infections, they can cause fatigue as well.
I just want to ask you one question
Sure.
about this fatigue thing.
Yes.
So you would have to check that with their blood to see
Yeah,
what is
yes.
causing it?
Blood, or urine, or sometimes other tests.
Okay.
Yes. A person might have a dietary protein deficiency. And then they don't notice it's causing an issue, so they work out, and then like, I'm so tired after my workouts, because the exercise just put them over the top, you see. You might be underhydrated. That can cause fatigue. Have I missed any? There's tons, of course, many, many more. You might have a slow metabolic rate. You might have exposure to electromagnetic radiation, which is damage your endocrine organs, and you have fatigue from that. And of course, multiple systems are involved at the same time because your body's always trying to compensate for these issues. So it's important to actually, I know it sounds cliche, but you must look at the entire person each time to really get a look as best as we can do that now. Okay. Did you have a question?
Yeah, if fatigue is caused by a drug side effect, can nutrition still?
That depends on the situation. Sometimes yes. So I have patients who come to me and they say, listen, I want to take these medications, they really help me, but I want to reduce future side effects, but I also have these side effects right now, fatigue is usually one of them. So if a practitioner knows the mechanisms of how that medication works, let's say that medication, interferes with the proper production of healthy fats in the liver, like statin medications for cholesterol, right? You might need those fats. You see, cholesterol is over here. Cholesterol makes pregnenolone. It's a very important hormone because that hormone makes progesterone, and that hormone makes testosterone. Testosterone makes DHEA, and then testosterone makes the estrogens. So if you have a medication that's reducing the cholesterol, you can have fatigue for any number of hormonal reasons. And hormones, by the way, when they act properly, are antioxidants and anti-inflammatories. So when I say what's from a hormone problem, you're probably thinking, oh, a low hormone problem, and that somehow is what's causing it, and that is true. But what it does in that particular person is important to figure out. So if one person has fatigue as a symptom, the other person has brain fog, and the other person has suicidal thoughts, all of which can be side effects of statin medications, you might want to enhance the nutrients that counteract that, but don't interfere with how the medication works. Nutritionists, like certified nutrition specialists and dietitians, which are the two licensed forms of professionals in New York at least, okay? I have those designations, I have many others, but I mention this because nutritionists do not have any training in laboratory work. They shouldn't be ordering lab, they shouldn't be interpreting lab, they shouldn't be looking at lab. These days, the labs are trying to make more money, so they allow nutritionists to order these tests, which is actually malpractice. And it should be malpractice because I've been to dietitian school and I've got the board certifications in nutrition. None of that teaches you lab. You need to be in some sort of a doctoral program, either chiropractic or medical or DO or perhaps a physician assistant, nurse practitioner, but you need to be careful with nutritionists interpreting your tests, okay? So, and you'll see that because most of my shows, I'm reviewing a lot of the information that you find in my book on the Anti-Aging Encyclopedia of Tests. And you can see that this is not easy. This takes work. And the books may say one thing, but that information relative to your actual needs may tweak it, like you have on this medication, or you're an airline stewardess exposed to huge amounts of radiation when you're flying all the time, wondering why your thyroid's the size of a pea. These are real concerns. So yes, the answer is sometimes yes, you can modify side effects for medications, and sometimes not. You want a trained person to do it so they know both positive and negative drug-nutrient interactions, and there are many of them. I knew two cardiology brothers in White Plains, and I was teaching nutrition, and I went to their office recently, well, not very recently, and then one of the docs was so excited. He says, Michael, I've had my patients on this grapefruit diet, they're losing all this weight. I'm like, that's phenomenal. I said, but how did you deal with the drug-nutrient interactions since most of the cardiac patients are on several drugs? He just went pale and started to sweat. He didn't even think of that. He simply didn't remember that grapefruits are the food that has the greatest number of drug interactions. So almost every a lot of them have that consideration. Most doctors forget, just like they forget to tell patients on blood thinners, do not take omega-3 fatty acids because it can kill you. You can hemorrhage. But they don't know. They don't know it because they don't want to know it. They certainly don't want to know what their patients are asking them about because their patients can't possibly know something that they don't know. And one doctor said to me, he says, Michael, if that were true, I would have learned it in medical school. I said, I'm just going to jump out a window. I'll see you later. I couldn't believe what I was hearing. But these are primitive, infantile, emotional reactions to challenge. Is really all it is. I'm always checking myself for these reactions too. Someone will say something I don't agree. I get that sweat. I'm like, okay, listen, because that was a reaction to some past experience. I want to be present to this patient now. Does what they're saying make sense? If it doesn't, well, I question them, and then really look at that and not just flip over it. Okay? Did I answer your question on meds and arthritis? There's different types of arthritis. I remember being at Grand Central Station. This was as long ago as 15 years ago. And I was waiting for my train, and there was a Scientific American magazine on one of the book stands, which is like the lay public science journal. And on the front cover, it was infections and the cause of disease. And it listed on the front cover, cancer, arthritis, diabetes, and a few other things. And I thought, well, arthritis, interesting. Do you think, we were taught in school, both chiropractic school and medical school, that arthritis is caused by gravity. Wear and tear, destruction of joints, but then gravity, causing the stress. If we had no gravity, we wouldn't have degenerative joint disease. If we lived on the moon, there wouldn't be no joint destruction. There'd be osteoporosis, but there wouldn't be joint destruction. So my point is that even infections can cause things like that, which we just thought of before as a simple mechanical stress. But there's different kinds of arthritis. So there's arthritis like osteoarthritis, which is called degenerative joint disease, which is a common arthritis that you know. And again, that's wear and tear and injuries predisposing you. But also poor nutrition or malabsorption over a lifetime. You don't absorb the nutrients, you don't get the nutrients that you need to build up your ligaments, tendons, muscles, joints, nervous system, so things break down. Gravity sees the weaknesses, it goes with the weaknesses, and you got all this joint destruction all over the place. And then there's infections that trigger inflammation, which can also trigger the immune system to work abnormally, and that can be part of an autoimmune response, which means that the immune system is involved in the degeneration. In degenerative joint disease, the regular one, it's not thought to be immune related, but rheumatoid arthritis, for example, or gout, or ankylosing spondylitis, or juvenile rheumatoid arthritis, which are some of the common autoimmune diseases, or any number of autoimmune disease joint problems that you might find in lupus or scleroderma or Sjogren's syndrome. These are all autoimmune diseases. One autoimmune disease almost always predisposes to others, but they all have at least one thing in common, that the degeneration is exceeded by the regeneration. So what do? You give the right nutrition. How do you figure it out? Through questioning, through what the literature says, what do we know about this disease? And then we look at the chemistries. I look at the chemistries in each person to see how each person is responding to the disease. And you put all of that together and other factors, and that orients you towards treating the actual person, rather than some of my colleagues and even me when I started giving lip service to treating the individual. Yeah, we're gonna treat the individual because it sounds great. What are you doing to do that? So you're saying acupuncture is the cure of everything? Well, why not nutrition? Like, why not both? Like, because the egos get in the way. Everything's energy, Dr. Walden. Okay, well, there's also the physical, when the energy is functioning at a lower vibrational scale. So why are you choosing one form of reality over another? And that becomes a whole philosophical conversation. But my point is that lack of thinking and fair evaluation is kind of rare among people, and certainly among healthcare providers, because we're people, I think the first step in trying to get better health, make better healthcare choices, and to be less biased, to be open more towards thinking, would be to first be aware of, are these thoughts mine? Is this something I believe or something I just inherited and I'm just doing it? Like being alkaline. What the heck does that mean? Can someone please tell me? Some of you are thinking, well, that means be alkaline. What are you, an idiot? Well, be alkaline where? See, thinking asks that. So, well, okay, well, be alkaline in my stomach? Wrong, because then you'd have no stomach acid, then you couldn't digest your proteins, you couldn't ionize your calcium, you couldn't clean B12 from your foods, you couldn't kill parasites, bugs here that you eat from your food so they get into the body, inflammation, leaky gut, everything else. You should be alkaline in your mouth, because the amylase enzyme to break down starch needs an alkaline environment. And the pH of the body sets the background, like the pH of a lake. If it's acid from acid rain, fish are dying, bones are floating around, algae overgrows, it's just a mess. The mineral content goes way up because the acidification of the rocks, and this has all these issues. So we want to be alkaline in our mouths, acid in our stomach, slightly alkaline in our small intestine. We want to be on the acid side in our urine, not alkaline. So people with urinary tract infections might know if you take probiotics, that might help you, like Lactobacillus acidophilus, right? Well, how does that work? If your pH in your urine is too high, that's on the alkaline end. Too low is on the acid end. When it's too high, that's what tends to cause urinary tract infections. So if you take acidophilus, acid, it acidifies the urine 30% of the time, will cure your infections by making you more acid there. So the thinking person, the blood detective logic, is question it really, so that you can know this better. Because forever and ever and ever, you probably never heard what I just said, but you know it's right? You don't need me to convince you of that, right? And if you think it's wrong, tell me why. Now or at any other point, and I will look at that. Just like I had to say to myself, yeah, alkaline sounds great. So if I eat alkaline, I'll become alkaline. I'd be dead, I found out. And if I were overly acid, well, you know, I'd be in a diabetic acidotic coma. So we need to be in a tight range of blood pH. So with all conditions on the world, our body must have the right pH everywhere it needs that right pH. So how do you get that done? Well, in general, you fix what you find that a person needs, because if you fix what they need, you're fixing the organs. So the organs work more normally. The organs secrete their secretions into the blood, and then they crosstalk, like an orchestrated crosstalk between the organs and the secretions, so that the pH is 7.4. Boom, right there, 7.35, 7.45, average 7.4, okay? So now urine and saliva pH, by the way, that goes up and down every 2 seconds. If I say boo to you, I can change those pHs, but practitioners will rely on those because they don't have proper training and they don't understand pH as much as even you do right now. I do the same thing at the professional seminars. I'm like, who loves alkaline pHs? We should be alkaline, right? Yeah, Dr. Wall. Wrong. And here's why. No one out there, even the people smarter than me, can possibly counteract that with any reasonable argument. So you identify what a person needs for their needs, which means you're supplying their organs with what they need so they make the proper secretions so the proper pHs happen where they should be and what they should be. So if you have really good health, you'll have an acidic environment in your stomach. And if you are doing the right thing overall, your blood pH will be about 7.4. And when that blood pH is less than 7.35 or higher than 7.45, major metabolic disturbances happen. Unlike urine and saliva, where those numbers, as I mentioned, they're changing constantly. I'm not saying there's no use ever in looking at saliva pH or urine pH. Well, maybe urine pH, I mean, that would certainly be the most important one because of the infection, connection. But if you, no matter what you do to improve your health, you could meditate on a mountain and, suck sun energy for food if you want to, but if you don't improve those pHs and don't improve that body composition, then you're not doing anything for the long run. So body composition, let me get to that. Every single disease that's killing people results in poor body composition. Whether it's autoimmune disease or any chronic arthritic condition or fatigue, which is, remember, just the term, which comes from one or more processes gone awry, possibly. Or maybe not even awry. The body might create fatigue because it's trying to slow you down to prevent you from burning yourself out. Just like in a woman, the estrogen levels drop so that, when you're 50, you don't have as much ovarian and prostate cancer. The longer estrogen's around, the higher risk of developing estrogen-related cancers. So maybe we shouldn't be taking natural estrogen like the natural field says simply because it's natural. Cyanide's natural. I'm not going to take that, So, and just because natural hormones are natural, which they're not actually, because you can make hormones, from wild yams or let's say soy products in a lab with a certain enzyme that you must introduce into that process, and then you can make progesterone and estrogen. But there's no hormones in plants. There never was. There might be in the future, but there's not any now. So that's just misinformation, just like pH is misinformation and detox is completely misconstrued. So back to the body composition. Why is that related to every cause of disease? Because it is. Tufts University, they're some of the leading experts on human aging. They found that, and others found that, but they really popularized it in a book that they put out for lay people called Biomarkers. All their biomarkers are in my book. And then a professional level book also called Biomarkers, a little more detail. But the number one test that predicts lifespan and health span, not just living longer, but living longer during the non-disability stage of life. Where you want it. I mean, I want more years, I think, but I want years where I can do stuff. And do stuff, not just walk. When I want to climb rocks if I want to. I want to jump over a puddle if I feel like it, So they found that the worse your body composition, that's a direct indicator of increased risk of disease, earlier onset of disease, and more severe experience of disease. So what do you do about that? Well, you maintain a good body composition. What does that mean? That means the body comp will measure your percentage of muscle, water, and fat in the body, your metabolic rate, a whole bunch of other important factors, but the lean mass is going to measure. Your lean mass is the thing. So if you age with any of these conditions and you lose lean mass, that means like an old person, they lose their mass, they atrophy. That's loss of lean mass. It's the organs and the muscles. That's what drives all your organ function and produces all your chemistry. So the more lean mass you lose, the less organ function you have, and then your health deteriorates accordingly. But if you meditate and eat right, whatever that is, take the right nutrients, which you know are right when your lean mass increases, then that's correlated with less disease. Like a measurable decline in all-cause morbidity and mortality. Okay? Vitamin D is similar. The lower your level of vitamin D, the higher risk of you dying of anything. And the number, see, as a blood detective, and as my book points out, there are regular ranges for any blood test. And this applies to any disease we are evaluating. Look at the blood, right? What are the things you might look at? So vitamin D levels are supposed to be between 30 and 100. Some labs have crazy ranges, like 30 to 50. I just saw one. I don't know what they base that on. I'll get you in 1 second. And the vitamin D studies, so they looked at all the vitamin D studies, and they realized that most of them were just done wrong. They were just bad studies, there's bias, and they calculate for all this stuff. So they'll say things like this: of the 523 studies on vitamin D, we eliminated all but 420 of them because they weren't scientific. Okay, done. And this is done all the time. This is science. We're supposed to be trusting, and most of the studies are a joke. That's what's happening. But then they take the correct ones and they do a meta-analysis of them to see, well, okay, this one says this much, that one says that much, but they were all properly done. So the magic number for vitamin D is 70. Okay, so 70 is the magic number if you're gonna shoot for a number. They also say that the higher normal your vitamin D, the better. So I try to get my people at about 100. If you're concerned about vitamin D toxicity, just look at your calcium, look at your liver enzymes, and if those go up, stop the D for 2 weeks, then your levels will go to normal, then start again with a lower dose, so it's all good. As long as you're being monitored, no problem. Yes?
Is that number new? Because I saw a chiropractor who actually was the first one who found vitamin D deficiency. Not, excuse me, an acupuncturist, and I went to my doctor, didn't believe in it, blah, blah, blah.
Your doctor didn't believe in vitamin D?
No, she started testing after I left her. I said, you're either gonna test me or I'm leaving the practice. It's another story. But he said to me, your vitamin D should be 50, not over that. So is this something new that it's higher now?
No, that's not new. That is what is, that seems to be the perpetuating concept, that you want to be at 50 because when you do populations, then you test their D levels, they determine that 50 is the average of where the D is, and somehow you should be there with average people. So I don't know about you, but I like to compare myself to healthy people, and healthy people have a 70 or above. So that's based on the minimum amount. It's exactly the same ridiculous, wrong reasoning as a doctor saying to you, you don't need to take a 500, 1,000 milligrams of vitamin C. The RDA is 60, just have a glass of orange juice. Okay, well, if you want to create diabetes, do that, like I've said in the prior talk. But the body stores roughly, this is a rough number, 2,500 milligrams of vitamin C. If you were in a vacuum, like in one of the science fiction movies, and there was a steady state of 2,500 milligrams, and you were in a vacuum, right? And you had certain metabolic stressors, you would lose about 60 milligrams of that every day. So that's where the 60 milligrams came from, the minimum amount to keep the maximum dose there. But these doctors misread labs because they stink at labs, and they think that the 60 is the minimum for everyone. Well, what if you're pregnant? Well, oh no, that's an exception. What if you broke some bones? Well, yeah, that's an exception too. Well, what about how each person ages in their individual diseases or stressors, which would increase vitamin C? Then they just look at you. So that's a common misinterpretation, and it's malpractice. And then also about how much vitamin D do you give if it's actually less than 30. So if you're of normal weight for your age, you take 50,000 units. 50,000, not 5,000, not 10,000, 50,000 units once a week for 8 weeks, and then you recheck the lab. So rechecking almost never happens. Then most doctors say when the number is low, particularly when a patient asks, that's a danger because the doctor obviously doesn't know. So you're putting them in a position of them not understanding a lab test, and then when it comes out abnormal, they don't know what to do, so they don't tell you the right things to do. So they might say if they're average, they'll say take some vitamin D. They'll exactly say that, take some. Well, what does that mean? How much? Or if they're a little smarter, they'll say take 1,000, take 2,000. The other smarter ones slightly say take 5,000, take 10,000. They're all wrong. If it's less than 30, The studies say you give 50,000. Now, if you're overweight, you generally take 100,000, thank you. And then you do that for 2 months, and then you recheck the labs, and then you titrate to whatever amounts the person needs, and you fix it in the long term. That's how that's done.
What brand is a good brand of vitamin D?
As far as brands, you just need to email me about that. I might have a question or two to ask, because you don't base the best vitamin based on a brand. You base it, that's part of it. And most of the popular brands are terrible. And they're popular because they're great in marketing, they're not great in science. Usually the more expensive the nutrient, the better it is, but the form of the D for the person should definitely be D3, should absolutely be D3. Depends on the manufacturing process and the quality process, and I have a list of those things, and then I look at the person for all the nutrients to decide, should it be my nutrients or a combination of mine and others that's the best for this person's individual experience. And then you check testing and you retest them, then you figure it out. Okay. Last question for the topic, and then we're going to go on to our next topic. Yes.
What about K2 and vitamin D? Does that help you absorb it better?
Yes, vitamin D will, if it's taken with vitamin K, since it's fat soluble, tends to increase absorption. Plus, vitamin K2 is extremely important for heart health, bone health, and anti-cancer effects. Yep, absolutely. K2, though, if a person is on clotting medication, they need to be careful with increasing their K2 too much, because vitamin K is a pro-clotting factor. So that might clot you when you're trying to anti-clot yourself. Okay. So just to finish off, to remind you that you can, again, listen to my podcast or go to my website at drmichaelwalt.com. The podcast on any platform, just search for Ask the Blood Detective. And if you wanted to reach me, just fill out the form here too, and then we'll also put you on the list for the contest for winning these 2 books, both of which I wrote. And you can reach me through email for other topics, because all the topics that I do here are from people letting me know what they wanted to hear. Just email me at info@blooddetective.com. And the website's drmichaelwalt.com. Thank you, everybody.